Imagine waking up one morning with angry red rashes spreading across your skin, or picture yourself after a nasty fall, unable to put weight on your leg. You know you need a doctor, but which one? That single question trips up more people than you'd think, because the medical world isn't a one-size-fits-all system. There are dozens of specialists out there, each trained to handle a very specific part of your body or health. And today, we're going to break all of that down for you clearly, simply, and in a way you'll actually remember. By the end of this video, you'll know exactly which doctor to call, no matter what health issue comes knocking at your door. So let's dive straight in. The first doctor on our list is someone almost everyone has visited at least once in their life, the general practitioner, or GP. You might also hear this person called a family doctor, and that name really does say it all. Think of your GP as your first stop whenever something feels off. A sore throat that won't quit, a stomachache that's been bothering you all week, a persistent headache, or even a runny nose that just won't clear up. These are all situations where you pick up the phone and call your general practitioner. They're not specialized in one particular area of the body. Instead, they have a broad, well-rounded knowledge of medicine that allows them to diagnose and treat the most common, everyday health concerns. And when something turns out to be beyond their scope, they're also the ones who refer you to the right specialist. So in many ways, your GP is the gateway to your entire healthcare journey. They're the doctor who knows you, your history, and your body best over time. If you haven't built that relationship with a family doctor yet, now is a great time to start. Moving on, let's talk about a doctor you might visit if your skin starts acting up. That specialist is called a dermatologist. The name might sound complex, but the role is actually very straightforward. A dermatologist is a doctor who focuses exclusively on three things: your skin, your hair, and your nails. So the next time you notice an unusual rash spreading on your arm, or your scalp is giving you trouble, or your nails have started changing color in a way that doesn't look right, a dermatologist is exactly who you need to see. Skin is the largest organ in the human body, and it's constantly exposed to the environment, which means it can develop a wide range of conditions. From acne and eczema to more serious issues like psoriasis or skin infections. A dermatologist has years of specialized training to identify and treat all of these. So don't brush off skin problems as minor inconveniences. Your skin is always trying to tell you something, and a dermatologist knows how to listen. Now here's a doctor that most of us have a complicated relationship with: the dentist. Go on, admit it. A lot of people feel a flutter of anxiety the moment they step into a dental clinic, and honestly, that's more common than you think. But here's the truth: avoiding your dentist is one of the worst things you can do for your overall health. Dentists are the medical professionals who specialize in your mouth, specifically your teeth and your gums. They treat cavities, gum disease, infections, and a whole range of other oral health issues that, if left untreated, can actually affect the rest of your body too. Poor oral health has been linked to heart disease, diabetes, and other serious conditions, which is why medical experts consistently recommend visiting your dentist at least twice a year, even when nothing seems wrong. Those routine checkups can catch problems early, before they turn into something far more painful and expensive to fix. So if it's been a while since your last dental visit, consider this your reminder. Your teeth are worth taking care of. Let's shift from your mouth to your most vital organ, your heart. The specialist responsible for keeping it healthy is called a cardiologist. A cardiologist is a doctor who focuses entirely on the cardiovascular system, which includes your heart and all the blood vessels connected to it. If you've been experiencing chest pain, shortness of breath, irregular heartbeats, or if you've been diagnosed with high blood pressure or high cholesterol, a cardiologist is the doctor you need in your corner. They run tests, interpret results, and develop treatment plans to manage or prevent serious cardiovascular disease. Now, there's one thing a cardiologist unfortunately cannot fix, and that's a broken heart in the emotional sense. When a tough breakup leaves you feeling completely shattered, no amount of medical expertise can mend that. But when it comes to the physical heart and everything that keeps it beating strong, a cardiologist is your person. Given that heart disease remains one of the leading causes of death worldwide, building a relationship with a cardiologist, especially as you get older or if you have risk factors, is one of the smartest health decisions you can make. Next, we're going to talk about a doctor who plays a crucial role in women's health, the gynecologist. A gynecologist is a specialist who focuses on the female reproductive system. From puberty all the way through menopause, a gynecologist is trained to handle a wide range of concerns, hormonal imbalances, menstrual irregularities, infections, fertility issues, and routine screenings like pap smears. You'll often hear people refer to this doctor simply as a gynaec, which is just an informal shorthand for the full term. For many women, their gynecologist is one of the most important doctors in their lives, someone they visit regularly for both preventive care and treatment. However, there's an important distinction worth understanding here. When it comes to surgical procedures, such as cesarean sections during childbirth or the removal of ovarian tumors, the doctor performing the operation is not called a gynecologist but rather an obstetrician. An obstetrician is a specialist who handles the surgical side of female reproductive health. So while your gynecologist manages your overall reproductive well-being and guides you through pregnancy, it's often an obstetrician who steps in when a procedure or surgery becomes necessary. In many cases, doctors are trained in both fields and carry the title OB/GYN, meaning they can handle both roles. But knowing the difference helps you ask the right questions and understand exactly who is responsible for which part of your care. Now let's talk about someone you might visit if you've been squinting at screens or struggling to read signs from a distance: the optometrist. An optometrist is your go-to eye doctor. Whether you're dealing with blurry vision, eye strain, infections, or simply need to find out whether you require glasses or contact lenses, an optometrist is the professional trained to assess and treat all of that. Your eyes are incredibly complex organs, and even minor changes in vision can signal underlying issues that deserve attention. Many people put off eye checkups because their vision seems good enough, but optometrists often catch early warning signs of conditions like glaucoma or macular degeneration before symptoms become noticeable. Regular eye exams aren't just about getting the right prescription, they're a window into your overall health. So if it's been more than a year since your last visit to an optometrist, it might be time to book that appointment. From your eyes, let's move to your bones. If you've ever broken a bone, dealt with a sports injury, or struggled with joint pain, then you've likely crossed paths with an orthopedic surgeon. This specialist focuses on the skeletal system, meaning bones, joints, ligaments, tendons, and muscles. Whether it's a fractured leg from an accident, a torn ligament from playing sports, or chronic knee pain that's been wearing you down over the years, an orthopedic surgeon is the doctor equipped to diagnose and treat it. As people age, conditions like arthritis become increasingly common, causing significant pain and limiting mobility in the hands, knees, hips, and spine. Orthopedic surgeons don't just perform operations, they also design rehabilitation plans and recommend non-surgical treatments whenever possible. So think of them not just as bone doctors, but as specialists in helping you move through life comfortably and without pain. Our next specialist works with some of the youngest and most delicate patients in medicine, and that doctor is called a pediatrician. A pediatrician is a doctor who specializes in the health and development of infants, children, and teenagers. From a baby's very first checkup to a teenager's annual physical, pediatricians guide the health journey of young people through every stage of growth. They diagnose and treat illnesses, track developmental milestones, administer vaccinations, and provide parents with guidance on nutrition, behavior, and overall well-being. If you've ever visited a pediatric clinic, you've probably noticed something different about it right away. The walls are bright, the waiting room is filled with toys, and the whole space is designed to feel welcoming rather than clinical. That's entirely intentional. Pediatricians understand that children experience fear and anxiety in medical settings, so creating a comfortable environment is part of their approach to care. If you have children, your pediatrician is one of the most important relationships you'll build. Because they're not just treating illness, they're supporting healthy growth from the very beginning of life. Now, here's one that people frequently mix up, and it's important to get it right. We're talking about the urologist. A urologist is a doctor who specializes in the urinary tract, which includes the kidneys, bladder, and the tubes that carry urine through your body for both men and women. However, a urologist also handles issues related to the male reproductive system. This is where the confusion often comes in. Many men assume that if they have concerns about their reproductive health, they should see a gynecologist. But that's not the case at all. Gynecologists work exclusively with the female reproductive system. Men dealing with reproductive health concerns such as fertility issues or prostate problems need to see a urologist. So whether it's a urinary tract infection, kidney stones, bladder issues, or male reproductive concerns, a urologist is the right specialist to consult. Knowing this distinction can save you a lot of time and ensure you get the right care from the start. We've saved one of the most fascinating and complex medical specialties for last. This is the field that deals with the most intricate organ in the known universe, the human brain. The doctor who specializes in brain and nerve-related conditions is called a neurologist. Neurologists are trained to diagnose and treat disorders that affect the brain, the spinal cord, and the entire nervous system. If you're experiencing persistent migraines, unexplained seizures, memory problems, numbness in your limbs, or any condition that seems to involve your nerves or cognitive function, a neurologist is the specialist you need. Conditions like epilepsy, multiple sclerosis, Parkinson's disease, and stroke all fall within the neurologist's area of expertise. Now, when a condition is severe enough to require surgical intervention, say, a brain tumor that needs to be removed, or a spinal cord injury that demands an operation, the doctor who steps into the operating room is not the neurologist but a neurosurgeon. Just like the distinction between a gynecologist and an obstetrician, this separation exists because surgery is a highly specialized skill set on its own. A neurologist diagnoses and manages neurological conditions through medicine and therapy, while a neurosurgeon physically operates on the brain and nervous system when necessary. Together, they form a powerful team in some of the most critical and life-changing medical situations a person can face. And that brings us to the end of today's script. We've covered a wide range of specialists, from the general practitioner who handles your everyday health concerns, all the way to the neurosurgeon who operates on the human brain. Each of these doctors has spent years mastering their specific area so that when you walk into their office, you're in the most capable hands possible. The key takeaway here is simple: knowing which doctor to see is just as important as deciding to seek help in the first place. The right specialist at the right time can make all the difference. Now that you have this knowledge, put it to use, and the next time someone around you isn't sure where to turn for a health issue, you'll know exactly what to tell them. Each part is approximately 900 words, flows continuously from the previous, and ends at a natural transition point. The style, tone, and pacing remain consistent throughout. Let me know if you'd like any adjustments. Sonnet 4.6 Low.